Listen, if you're prepping for high-stakes dental boards right now, you already know the deal. The sheer volume of information you're expected to retain is, frankly, completely staggering. Well, welcome to this explainer. Today, we're going to walk through a fascinating platform called DentAIstudy. We're going to pull directly from their platform design and actual user experiences to show you exactly how it transforms traditional, heavy academic revision into targeted, high-yield study sessions. Okay, let's dive right in. So, I really want you to ask yourself a quick question. How do you currently study? Seriously, are you tired of jumping across a million random browser tabs, juggling these dense academic PDFs, and just struggling to synthesize hundreds of pages of textbooks into something you won't immediately forget on exam day? It's completely overwhelming, right? Well, that is the exact pain point we're examining today. And honestly, it's the specific problem this platform was built to solve. Look, we all know we live in an AI world now, but relying on generic AI chatbots for clinical knowledge, that is incredibly risky. Generic models can and do hallucinate facts. They misunderstand clinical contexts and can even provide dangerous non-clinical advice. DentAIstudy, on the other hand, is explicitly designed as a dental-only ecosystem. It's hyper-focused, it's exam-ready, and it's built strictly for studying and revision. It pulls you completely away from the chaotic noise of generic AI and drops you into a trusted, specialized workspace. So the core mission of DentAIstudy is pretty straightforward. It's meant to act as your dynamic, purpose-built study partner. The whole idea is to keep all your revision materials in one single focused hub. Instead of piecing together fragmented notes from various lectures or random websites, the platform is structured to align directly with your specific global exam route, whether that's the INBD, the ORE, or the 8X. It essentially acts as a centralized engine for your entire dental career path. To really understand how this magic happens, we need to look at the platform's study builder. It operates on a super simple 3-step process that basically does all the heavy lifting for your board prep. Step 1, you choose your study mode. Step 2, you upload your dense topic or PDF. And Step 3, you get clean, exam-ready notes. Let's break these steps down, shall we? All right, Step 1, choosing your mode. Before you even upload a single document, you set your intent. You select exactly how you want to study based on what you need right then and there. Sometimes you just need a quick answer for rapid recall, sure. But for the really complex topics, you're going to want to use the deep study mode. This generates a longer, highly structured output that is just perfect for fuller revision. It is absolutely crucial for unpacking complex, specialty-level clinical nuances. I mean, when you're dealing with advanced oral pathology or super intricate endodontic diagnoses, surface-level summaries just aren't going to cut it. You need depth, and that is exactly what this mode targets. Moving on to Step 2, the clinical stress test. Okay, to see how this actually holds up, we're putting this tool to a live stress test. We pulled a highly complex, multi-page clinical case report straight from the medical literature. Specifically, an actual post-operative radiograph of an Acanthomatous Ameloblastoma of the anterior mandible. Notice the marginal mandibular resection there, followed by stabilization with a reconstruction plate because of this aggressive expansile ameloblastoma. When you're studying for boards, looking at imaging like this and actually understanding the surgical management, the aggressive nature of the tumor, and the radiographic patterns, like that classic soap bubble appearance, that is heavy, intimidating work. And guess what? It gets even denser. The source case also includes histological slides. Just listen to the academic jargon you're expected to memorize here. Islands of odontogenic epithelium, peripheral columnar cells with hyperchromatic nuclei exhibiting reverse polarity, and loosely arranged stellate reticulum-like cells. Wow. It is literally exhausting just reading it out loud. But this is the exact kind of dense pathology that absolutely grinds your revision to a halt. You could spend hours just trying to synthesize the radiograph and these histological findings into a single, coherent study sheet. Which brings us to Step 3, the transformation. When you feed that incredibly dense, multi-page ameloblastoma case report into deep study mode, the platform goes to work. It processes all that academic text, the histological descriptions, the clinical management details, and it transforms them entirely. The engine instantly generates top-tier structured outputs. We're talking customized OSCE flows, compressed high-yield sheets for fast review, clean flashcard decks for active recall, and beautifully organized exam-focused notes. It literally rips the textbook fluff out and leaves only what you actually need to pass. I really want to highlight the OSCE flows specifically here because this brilliantly illustrates the real clinical value of the tool. An OSCE flow extracts all the critical clinical reasoning from that dense tumor case and structures it perfectly for a practical exam station. It breaks the data down into history, examination, investigations, like specifically calling out the need for a CT scan or MRI, and management, like that marginal resection we talked about earlier. It essentially trains your brain to think exactly like an examiner. But hey, don't just take my word for it. Dr. David Chen, who is an orthodontic resident, uses the deep study mode specifically to unpack complex mechanics for his residency seminars. He states it perfectly. The tool just strips away the fluff and leaves the exact, organized, high-yield notes you need for specialty-level discussions. It's a real game changer for him. And if you're looking for immediate practical application, check out this testimonial from Priya Patel, a dental intern. She talks about how she used to get completely lost in dense textbooks right before clinics. Now, she uses the study builder to generate those clean OSCE flows we just discussed. It gives her exactly what she needs to review in minutes, literally right before stepping into a room to see a patient. It perfectly bridges that massive gap between textbook studying and real-world practical application. Next up, prep for global lose. Of course, all of this powerful processing really only matters if it aligns with your specific licensure exams. DentAIstudy is brilliantly structured around dedicated global exam hubs. So whether you are prepping for the INBDE in the US, the ADEX OSCE in practicals, the ORE in the UK, the NDEC in Canada, the ADC in Australia, or the SDLE in Saudi Arabia, the platform provides immediate localized relevance. You aren't just studying into a void hoping for the best, you are studying within the specific exact parameters and expectations of your licensing body. And alongside those exam-specific hubs, you can also jump directly into core dental subjects for broader discipline-focused revision. If you just want to focus purely on, say, cavity preparation and operative dentistry, or maybe space analysis in orthodontics, or the logic behind pulpectomies in pediatric dentistry, you can navigate straight to those subject hubs. It keeps everything incredibly organized and focused. So, what is the bottom line here? DentAIstudy is an essential, high-end tool designed exclusively for dental professionals. By keeping you far away from the risky waters of hallucinating generic chatbots, it elevates your clinical reasoning, it streamlines your workflow, and it absolutely builds your exam confidence through highly targeted, structured outputs based on your very own study materials. I'll leave you with this final thought today. You have seen firsthand how a dense, intimidating, multi-page pathology report on an ameloblastoma can be instantly transformed into manageable, high-yield study cards and OSCE flows. So, what about you? Are you ready to stop drowning in textbooks and finally start studying smarter? Taking control of your exam prep might literally just be a few clicks away. Thank you so much for joining me for this explainer, and hey, happy studying!